Hey class, in the previous videos we have introduced the stroke as well as the treatment of the stroke from acupuncture. It is very important that when to apply acupuncture. As for the acupuncture treatment, it is actually the sooner the better. The best time for the treatment is within 1 month. Up to 3 months, you still can receive very good results. So up to 3 to 4 months, I normally require the patient to have the treatment every day. Even someday we will apply the treatment on the patient. But after half a year, sometimes the results is not as significant as the first half a year. That's why the time is very important when to accept acupuncture. In this video, we are going to introduce a few cases. The first case was a gentleman that I saw in 2017, 40 years old. When I saw him, he already had the stroke 1.5 months. The patient suffered from sudden falling down with unconsciousness, and he was sent to the hospital diagnosed as ICH. After the treatment, the vital signs were stable. He has been treated with physiotherapy for the recent 1 month. However, he still suffers from complete paralysis on left side, facial paralysis. Currently, the patient is conscious, good appetite, sleep well, constipation, impairment of the left side, rubbing skin sign, positive. Pale tongue with a thin white coating, slippery pulse. So the main problem now at this stage, the patient, the left side of the body could not move, and this is the image that's from the CT scan, the bleeding, where the bleeding on July, the 4th of July. When we see patients present with stroke, it is very important that we need to evaluate the force of the muscles. It is also very important to evaluate from different scales. The commonly one used is ADL and NIHSS. So when you evaluate these in a few days or before or after treatment, you will see the improvements. This patient also suffered from diabetes, coronary artery bypass grafting, chronic heart failure, chronic kidney failure. So this patient presents as multiple complications. These are not due to stroke, but that's the past disease history. The CT scan was done on the 28th of June. Bleeding, and it was done again on the 4th of July. That's what I said in the previous video. In a few days, you need to double check again. Because the moment you check in June, the first time, may not be the peak. After a few days, the size become even bigger. But previously it was 69 by 28, and after a few days become 80 to 44. That's another reason why after a few days treatment, the patient may present even worse. Although I didn't treat this patient at the beginning, this patient was in hospital from the day 1. But even if we apply acupuncture or Chinese herbal medicine on the 28th of June, the patient also may present worse after a few days because the disease is still developing. This patient, because of the coronary artery bypass, he was taking warfarin, and this warfarin was discontinued right after ICH. Warfarin is the anticoagulant, so it will result in bleeding. So they have to stop warfarin. For this patient, I used 2 groups of treatments. to 20, axial points to 26, stomach 4 to stomach 6, lung 5, 11, large intestine 10, pericardium 6. 灵骨, 大白, these are very close to large intestine 4. GB 30, 31, bladder 40, spleen 6, kidney 3, liver 3. Group 2. So I see this patient every day, 30 minutes. The skull acupuncture. After 14 days, the force of the muscles from 0 improved to 2 to 3. From the lower limbs, from 0 to 3 to 4. When he presents at 3 to 4, he can walk. The NIHSS, the higher the worse, from 11 to 3. The ADL from 30 to 75. 30, the ADL, 30 is major dependence. 75 is minor dependence. That's the significant improvement. MIHSS from 11 in this category, moderate stroke, to 3, minor stroke. So as you can see, this is the significant improvement. And this patient also has been with the conventional medicine treatments, with the physiotherapy treatments for 1.5 months, and all these happens after the intervention of acupuncture. These are a few videos demonstrate the improvement from this patient. The second day after the treatment, the left leg start to move left and right, but when I asked him to lift up, he could not lift up well.
对，好，抬起来，好，试试抬起来。好。
The second video was taken on the 24th of August. This is also almost on the 10 days of treatment. You can lift up much easier.
动一下脚，拿起来，像之前那样。对。
After 2 weeks, you can walk upstairs. So these 3 videos were almost achieved within 2 weeks treatments. And sometimes people always doubt the acupuncture treatments. Were these improvements from acupuncture treatments? So is it from conventional medicine or from physiotherapy? Because this patient also accepted the physiotherapy at the same time. Sometimes I will ask them, this patient, when I see this patient already have suffered from stroke for more than 1 month. Why there's no improvement for this 1.5 months? Why the leg start to move on the second day after the acupuncture treatments? Especially for the first video, the significant movement. At the beginning, there's no movement at all. After the acupuncture treatment on the second day, while the patient only start to move after acupuncture treatment. Especially for someone they don't like acupuncture, they always doubt the efficacy of acupuncture. This patient he was very unlucky. On the 29th of August, he suffered from another stroke. Remember that this patient suffered from ICH, and then he was taking warfarin, and then because of the ICH, the warfarin was stopped immediately after the ICH. So for more than almost 2 months, he stopped the warfarin. On the 29th of August, this patient suffered from another stroke, ischemic stroke, because he didn't use the blood thinner, the anticoagulant. These clots in the brain created and further developed into the ischemic stroke. This patient was admitted in the ICU wards, and at that time, I was invited to treat this patient in the ICU wards. After almost 3 weeks, on the 19th of September, this was the improvements from after the second stroke. During the second stroke, the patient became unconscious again. This patient now recovered much better than 2017. He even can cook for the family. From this case, there are at least 3 aspects that we need to discuss. The firstly is the coagulopathy. The coagulopathy, whether medication induced or from the disease itself, it is associated with the hematoma expansion. Hematoma is associated with the hematoma expansion and increase the risk of the poor outcome or even death. The second is the blood sugar. The high blood sugar will worsen the morbidity and mortality. Chinese medicine treatments can be applied as soon as the patient's condition is stable. The second case, a 57-year-old gentleman suffered from ischemic stroke. From the image, from the CT image, you will see that it is not easy to see where the affected area. But on the first day of the treatment, after the treatment, start to move a little bit of the arm. Before the treatment, he also couldn't move at all. So that's only after 30 minutes, the elbow start to move a little bit, but the arm, the hand still could not move. That's all what he can move. After a few days. After almost 3 weeks, even can walk upstairs, up hills. The third case, a 69-year-old female. The treatment only applied in after 1.5 months. after the first treatment, you try to see this patient is the local Chinese, so you won't understand the language, but you try to see the lip. And also from the image, you can see this is the ischemic stroke. This lady got 2 strokes. The first one on the side, the second one closer to the center.
Yeah.
You try to ask her to count 1, 2, 3. She couldn't because when you see from the lip, after the second treatment, but on the second day, she can call her daughter's name after almost 1 month.
A B C D E
This patient was also with the physiotherapy, with occupational therapy, with speech therapy from the beginning of the stroke until even with the acupuncture treatment. All these only happens after the acupuncture treatment. So as you can see from these a few cases, a stroke is one of the acupuncture is one of the most effective way for stroke, especially for the secretor, no matter from speech, from the impairment of the movements. The next patient, also from stroke, 28 years old gentleman. This stroke is not disease induced. He got a surgery, and during the surgery he got a stroke. But after 9 months, during the first treatment, after the first treatment, I want you to hear his speech.
Yeah, for the first time, how many months did I sleep? Because this side is too, it was too uncomfortable. Yeah, so like this.
So like these 2 days you slept well.
Yeah, I can hear the difference. Yeah.
So I want you to compare in his speech the so because we are recorded video, you can listen again the between his speech and then after a few days.
I don't know what's the problem. But she's so far away, so it's unnecessary, If it is nearby, I can solve it.
But at least telephonically we communicate.
Yeah, but we communicate, but mostly about the kid, and in general.
As you can see here, when you compare with these 2 speeches, the second one is much more clear. For this patient, I used the tongue 3 needles.
Yeah, I don't know.
The last case we are going to introduce is a 68-year-old lady. She was a visitor to South Africa from China. She landed at Oa Temple and immediately he got stroke. She also suffered from hypertension. and then she was admitted into ICU wards. These are some of the images and records. On the 10th of 12th, from the doctor's notes, remains unresponse, unconsciousness. So this patient she was actually the stroke that's attacking the Zangfu organs. Remains unresponse. On the 11th of December, conditions remains non-response. That's from their records. And then on the 13th of December, new conditions remains in the same. Open eyes on stimulation, stable. On the same day, another daughter, waking up, base commands, can blink as request. This patient, as you can see, this patient, when I applied the treatments, her condition is not stable at all. She was still unconscious. She was in the ICU wards. And then for her, I used Chinese herbal medicine and acupuncture. After almost 1.5 days, she can obey orders. She can open the eyes. And then what happens, or which formula I use for this patient, and why I use this formula? This is collapse syndrome. The hand will open, will cold. So we use acupuncture to restore yang. In the meantime, I also use herbal medicine to restore yang. The herbal medicine, 补阳还武汤. So the herbal medicine I use, 补 Bu 阳. Huan, Huan, Tang. This formula is very important to restore yang. Wu yang means restore yang. Huan means return. 5. Tang decoction. From the title, restore yang, why return 5? So in a theory, or in this school, the practitioners, they said that in our body, we got 10 portions of yang qi, 10 portions, and this formula can return 5, can help you to restore half portion of the yang. That's how strong the formula is. Yang Huan Wu Tang. So this is very important to restore the yang. As you can see, I use a big pot to cook the herbs. However, this liquid is too much for this patient. So I need to concentrate into these 2 small cups. Because because this was an unconscious patient. She won't drink a lot, although we use the tube to the stomach. You won't put like 200, 300 ml once. So I concentrate the liquid, the medicine, into 50 to 100 ml, about 70 or 80 ml each time. You take twice a day. And that's the results from the medical practitioners, from their records. It's the improvements from Chinese herbal medicine. As you can see here, these are a few examples. Acupuncture and Chinese herbal medicine can work very effectively in stroke. In most conditions, we will use acupuncture when the patient is stable. But if the patient accepts, and if the practitioner, especially the doctors in the hospital, they accept, you also can apply acupuncture or herbal medicine in the acute stage. We can work with the conventional medicine. We can assist each other. But to have a safe practice, try not to convince. You can give some advice for the patient, but try not to convince patients to accept the treatments to avoid further debates. Also, it is very important for safe practice. So the time is very important for all these cases that I have introduced here. The best result is the second gentleman who accepted the acupuncture treatment within 7 days. Now he almost fully recovered. So if you don't know he suffered from stroke previously, from the appearance, you won't see that he got stroke before. Due to the reason that he suffered, the location or the severe condition of the stroke is different from the others. But remember that this patient also suffered from complete hemiplegia before the treatment. The most important reason is because he accepted acupuncture on the 7 days, on the 7th days after onset. So the time is very important. All these cases, I don't treat them forever. I treat them 1 to 2 months, but I see them every day. So the time, the frequency is very important. We need to rush in the time. We need to treat the patient before 6 months. Although we use the time for 6 months, the best result will achieve in 3 to 4 months. After 4 to 5 months, you still can see improvements, but not as significant as the early treatments or early interventions. In these few videos, we mainly discuss the stroke. The stroke is one of the most important diseases because it is very common nowadays, and the mortality and the morbidity rates is very high. It can cause severe damage, and also acupuncture is quite effective in this situation. However, to understand the stroke, to have a better understand the stroke, especially from the conventional medicine point of view, it is not enough from our introduction. So if you have the chance, please read more information on stroke, especially from the conventional medicine. Although for our treatments, we don't really separate the ischemic stroke or ICH. For the treatments from Chinese medicine will be very similar, especially from acupuncture will be very similar. From herbal medicine, they will be slightly different, but from acupuncture will be very similar, and the principles are very similar to restore yang, to unblock the meridians. And in order to have a safe practice, to understand the prognosis, or even to predict the prognosis, in order to discuss with the patients, we need to have a better understanding from conventional medicine. And then from the knowledge from the conventional medicine, although we use different theory to explain stroke, when you apply acupuncture in the treatment, you need to think, you need to analyze from acupuncture point of view, from the basic theory. Otherwise, you won't be able to apply your treatments. For example, the ischemic stroke. If you think about the ischemic stroke, what you can think about is the activating blood circulation. You won't be able to understand the phlegm, the dampness. So although sometimes we introduce the knowledge from conventional medicine, in our treatments, we still need to focus on the theory from acupuncture. Thank you for your attention.